Well, I'd like to start by thanking you all for being here today. I know we all have busy work schedules, so I appreciate you taking your time to come and listen to my presentation. The purpose of today's presentation is to discuss how we as registered nurses can take steps to prevent the spread of MRSA in the hospital setting. According to the Office of Disease Prevention, one of the Healthy People Goals 2020 is to reduce the transmission of healthcare-associated methicillin-resistant Staphylococcus aureus, which we all commonly know as MRSA. So today's presentation is created to review basic information regarding MRSA infections. We're going to examine how our attitudes towards MRSA and isolation precautions determine how well we abide by isolation precaution standards. We're also going to explore how registered nurses and other healthcare workers contribute to the spread of MRSA in the hospital setting. And finally, I will be presenting ways that we can better prevent the spread of MRSA while at work. So, a quick review of MRSA. MRSA is a bacteria that is commonly found living on humans. It is most commonly found on the skin or in the nose. It can cause a variety of complications, which include, but are not limited, to skin or wound infections, cellulitis or boils. It can cause sore throats or chest infections. It is also responsible for septic arthritis or osteomyelitis. It can cause pneumonia, endocarditis, toxic shock syndrome, sepsis, and sometimes I think we forget that MRSA can lead. Approximately 100,000 cases of active MRSA infections occur annually, and of these, 20% of patients will actually pass away as a result of an active MRSA infection. MRSA has evolved to resist the antibiotics that would typically be used to treat the infection. Patients with active MRSA infections tend to be hospitalized twice as long as patients without MRSA infections, and as a result, the cost of their health care typically doubles. It is estimated that 1 in 30 people is colonized with MRSA. Just because you're colonized with MRSA does not mean that you have an active MRSA infection, but the bacteria is present somewhere on your body. MRSA is spread by physical contact only. So it can be spread through equipment, furniture, clothing, and hands. Hand hygiene has been found to be the most effective way to prevent the spread of MRSA. Nurses and other healthcare workers can spread MRSA from one patient to another via contaminated skin, equipment, and clothing, but most often it is the hands that are responsible for transmitting MRSA. And interestingly, MRSA can survive on surfaces for days. While I was not able to find how many days it can survive, just because we are cleaning down surfaces does not mean that the bacteria is totally dead. Hand hygiene and the use of isolation precautions by healthcare workers has been found to significantly decrease the spread of hospital-acquired MRSA infections. So now I have a little pop quiz for you ladies to make sure that I'm doing an effective job teaching you. So, please describe 2 complications of MRSA infections. Donna.
Pneumonia and sepsis.
Correct. Both of these are complications of MRSA infections. Approximately how many people are colonized with MRSA? Me. Go ahead.
1 in 30.
Correct. 1 in 30 people are colonized with MRSA. At the end of this presentation, I will also be giving you a sheet of facts regarding MRSA, and these little tidbits of information will be on there for your reference. Okay, so now we're going to discuss some barriers to adhering to isolation precautions. According to research, registered nurses report that following isolation precautions for patients with MRSA takes up too much of their time. Nurses also report that in the event of an emergency, they're not going to stop and put on a gown and gloves while entering a patient's room. Finally, nurses feel that they don't always have access to the proper equipment to protect themselves from MRSA. Okay, so I would just like to take a moment to examine our attitudes regarding proper isolation attire when dealing with patients who have MRSA. For example, how often do you use the proper isolation precautions required? Do you regularly see your coworkers abiding by the isolation precaution standards? And how prevalent do you believe MRSA is in the workplace? Would anybody like to share? Donna?
I think everyone who works in the hospital has MRSA.
You know, it's interesting that you say that because a lot of times I do hear coworkers say, oh, it's just MRSA. Everyone has MRSA. Oh, I didn't put up the contact sign because the patient has MRSA. We all have it anyways. And I feel like this mindset is something that is hindering how well we take care of our patients. And I see some head nods out here. It looks like some of you other ladies agree that maybe we don't do the best job and we're not consistent with gown and gloves every time we enter a MRSA room because we think everyone has it and we think we all have it. However, according to the research, nurses caring for patients with known MRSA infections use gloves 68 to 82% of the time. Nurses use gowns 68 to 77% of the time. And this I find most interesting is that nurses perform hand hygiene after patient care 48 to 69% of the time. When I was doing my research, I would have thought that nurses were using hand hygiene properly in higher rates. And I also thought that the lowest percentage would be in the use of gowns. So this data was a little bit different than what I expected, but I'm also very shocked at how low nurses are abiding by hand hygiene. Failure to use gowns, gloves, and perform proper hand hygiene increase the likelihood that nurses and healthcare workers will spread MRSA from one patient to another. And to kind of go against the theory that all nurses, all doctors, all healthcare workers have MRSA, research has found in 2015 that 2 to 15% of healthcare workers carry MRSA. So it's not exactly that everybody has it, so we really do need to take steps to prevent contaminating patients and exposing ourselves to this bacteria. Studies have found that after one shift, MRSA and C. diff have been found on nurses' scrubs, and it's as prevalent as up to 500 colony forming units. So while I'm not a microbiologist, I do know that that's a pretty high incidence of occurrence. Studies have also found that 18 to 23% of healthcare workers' lab coats are contaminated with MRSA. And research found in one hospital that there was an outbreak of MRSA infections, and 39.4% of these cases were traced back to nurses who were failing to abide by gown, gloves, and hand hygiene practices. So what does all of this mean for us? As nurses, we are responsible for providing our patients with the safest care possible. In order to uphold the standard of care, we must take steps to more effectively enforce proper isolation precautions when dealing with patients with MRSA. Again, gown, gloves, hand hygiene. Make sure you clean the contaminated surfaces as well. We also must remind our colleagues to do the same. Physicians a lot of times will just enter a room with lab coats on, apparently, contracting the MRSA, and then they're spreading it around the hospital or in their places of work. This may require that we are educating our coworkers, including physicians. And on a positive note, change is possible. There was a study conducted over 8 years in a Veterans Association hospital, and researchers saw a significant decrease in the spread of healthcare-associated MRSA. Monthly rates of MRSA infections dropped by 87% in the ICU, 80% in the non-ICU, and 49% in long-term care facilities. These decreased rates of transmission occurred through institutional culture change. Staff were educated, kind of like what I'm doing today, to change the mindset that everybody has MRSA. It's not really a big deal. There was an emphasis on hand hygiene, strictly enforced isolation precautions. That nonchalant behavior or approach to isolation precautions had to change. And the hospital performed MRSA surveillance on admission and discharge for all of the patients included in this study. So in conclusion, the Healthy People goal to reduce healthcare-associated MRSA infections is absolutely attainable. As nurses, we have to take steps to implement proper isolation precautions in our places of work. And we also have to serve as role models and educators for other nurses and healthcare staff members to ensure that they do their part to reduce the spread of MRSA as well. It's a group effort. And again, I just want to thank you for participating in this educational opportunity.